welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about APS patients perceive their physical and cognitive function to be less than optimal, says a study. In a recent study conducted by University of Michigan Medicine, researchers found that many patients with Antiphospholipid syndrome or APS perceive their physical and cognitive function to be less than optimal. Patients with APS have many self-reported symptoms that impact on different dimensions on their quality of life. However, they do not routinely receive opportunities to explain these impacts in a way that can be connected to APS. It is even rarer for these patient reports to be systematically studied on a large scale. More often, APS is studied from the perspective of the physician. Here, the authors used validated patient-reported outcome measures to ask how patients viewed their health in a systematic and consistent way. 139 APS patients at University of Michigan Health were each given 3 questionnaires upon arrival to an appointment with their APS physician to rate their physical function, cognitive function, and pain intensity. The study found that roughly half of patients had a physical function score of less than 45, suggesting at least mild self-perceived impairment in how one is able to carry out their day-to-day physical activity. Another important domain, cognitive function, is often not assessed from a patient's self-reported perspective. A pioneering effort in this study was to systematically assess the relationship between cognitive function and the quality of life. While the cognitive function questionnaires have not previously been deployed as widely as those for physical function, a quarter of patients with primary APS were assigned a cognitive score of less than 40, suggesting at least moderate self-perceived impairment in this area. Interestingly, impairments in self-reported physical function and cognitive function as well as higher pain intensity were not only associated with clinical markers suggestive of more severe disease but also with potentially modifiable lifestyle factors such as obesity and smoking status. Unexpectedly, patients taking drugs typically prescribed for mental health such as selective serotonin reuptake inhibitors also reported worse physical and cognitive function and higher pain intensity. Struggles with mental health are common in patients with unpredictable autoimmune diseases like APS, although the impacts of mental health and associated medications have only rarely been studied in this condition. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.